Welcome to another episode of Courageous Healing. I'm your co-host and producer, Victor Escalante. Joining me in the studio today is Adele. Adele, say hi to our followers.
Hi, followers.
Today, we're going to tackle the topic of what treatment modalities are for domestic violence survivors. Out there, because we want to educate you. We want to empower you. We want you to understand that there is help. If Adele can do it, so can you. Adele, why don't you go ahead and get us started with your journey in overcoming the deep wounds of domestic violence?
So after my marriage ended and everything, my ex-husband went to prison, and the court cases and the lawyers and the trials and all of that stuff started. I also went into therapy. I went into, because I was diagnosed with PTSD. But I went into therapy and I stayed in therapy for 5 years. And the thing...
So listeners, if you don't know what the acronym PTSD stands for, because if you're just coming out of an abusive relationship, that stands for post-traumatic stress disorder syndrome. And that's a byproduct of the abuse that you went through. I liken it, I'll give you an example so you have a visual. If you beat a dog over and over and over again, all that dog has to do is to see you, or to see you raise your hand to know that a beating is coming. And so that pet is going to be shy, is going to be scared, because again, it automatically knows what it's coming. And what happens with victims is, in their mind, when they are triggered through one of the senses, anything in one of the senses, whether it's a song, whether it's a perfume, whether it's an image, anything in the senses can trigger an episode of PTSD. So go ahead, Adele. Tell us what that is like.
For me, PTSD was it was nightmares and a little bit of hallucinations and panic attacks. So the nightmares were mostly just replays of, the violence that I had lived through, or just some sort of violent dream. The hallucinations for me were very limited and didn't happen frequently, but it was kind of like all of a sudden at the corner of my eye, I thought I saw him. Like I thought, because you have that paranoia where he's following you. Is he following you around? Is he where like my ex-husband used to follow me? So you get that paranoia where you're like, oh my God, or is he here? Is he? And so sometimes I would just be driving and all of a sudden the guy in the car next to me would, like, something about his facial structure would make me like think of like my ex. But
yeah. And so what happens, listeners, is the brain is such a phenomenal instrument that it is, and this is what the data shows us, is that it's a algorithm predictive machine. And so it's always scanning. If you've been through something hurtful, it's always scanning for that pattern, for that algorithm that's going to trigger it. And so those hallucinations is your mind playing tricks on you, because again, it's in survival mode. It's trying to get you to take necessary precautions and actions to survive.
Yeah. And so it's the thing about PTSD is that it comes in different ways, and some people get it in nightmares, and some people get it in physical, like they start sweating and they have heart palpitations and they have anxiety or they panic. Well, the panic attacks for me were they would come and go. When I first had them, they would last for days, and then they would slowly as I learned how to cope with them, they would slowly not last as long. But one of the things I think that's so important, to your point you just made, Victor, is that is understanding the psyche and how PTSD is affecting you.
Yes,
It's everybody that has PTSD is different because everybody that has it caused from a different reason.
that's correct.
It could be a car accident that causes it. We know that veterans deal
Yes,
with it. So it's just that in the sense that it's what caused it and how you and your body and your psyche are reacting to it. So for me, I had a wonderful therapist who sat down one day and really asked me if I understood what post-traumatic stress disorder was. Now, when this happened, this was in the mid-90s. So going to Google to search something
yeah,
wasn't necessarily a thing yet.
right.
So back then it was Yahoo, and that still wasn't necessarily like a thing. You didn't really research the way that we research things today because the internet was available. It just wasn't the way that we did things back then on a daily basis. So when she sat down and she explained it to me, and she explained to me that basically it's my body's way of reacting and coping with what had happened to me for such a period of time. And she explained that my panic attacks were just my body's nervous system. She called it out processing. I don't know that that's necessarily the technical term, but my body's out processing of all of this overload of
Sure.
emotions, things that were happening in my brain. Basically, what I understood and what she helped me to understand was that when I had a panic attack, instead of trying to swallow it, stifle it, or to try to like not have it, was to have it, cry it, move through it, believe and know and trust
Yes.
that the panic attack was going to end. And
Correct.
that if it didn't end or that it got worse, that I could take myself to the emergency room.
Yes.
Like that I could take myself to the emergency room and that I can get some medical care, some immediate medical care that could help me to calm down.
That's called a full-blown catharsis. Okay, it's a release of emotion. It's a venting. It's a blooming. It's a coming out. Now, she gave you some very good advice, Adele, because most people try to repress it or dissociate from it mentally, to where if mentally you dissociate from it, you negate it, and you don't have a cathartic attack. Now, the benefit of having a catharsis is that once you are done, think of it like a bubble that's coming up, and when you release that bubble, you're done. That particular episode, that particular wave of emotions, you're done. I've had clients that have come to me in therapy, Adele, that they're crying and bawling and not coming out of their nose. And I let them, because if I would hand them a tissue, it would interrupt the flow of the catharsis. Okay. Because I need them to fully release everything that is coming up, because I probably induced a catharsis, or in retelling some kind of trauma, they are releasing the catharsis, and that's what needs to happen. So you had a very wise therapist that you were working with to train you to have that cathartic release without necessarily becoming overly preoccupied.
Right. And as a disclaimer, I mean, anybody who's been diagnosed with PTSD should be seeing a therapist
Yes.
at some point, because I couldn't do this. I didn't get through these episodes without her assistance, without her help, and without her guidance.
Mm-hmm.
I mean, not while I was necessarily in it. I didn't pick up the phone and call her in the middle of the night because I had a nightmare, but she gave me the tools and she gave me the things and explained to me how I could cope with it. And once she learned and figured out how I was coping with things, then we kind of worked on things together. Like, for example, one of the things that worked really well for me was because, of course, I mean, I needed to work. I have to work. I have to, I had to live. I had to exist in the middle of all of that. And the thing is that I worked with her and we came up with a plan where if I felt a panic attack coming on or something coming on in the middle of the day, where it would have taken me out of work or I would have completely, broken down in hysterics. And at that point, I would have been excruciatingly embarrassed that I would have done that at work. She and I worked on this thing where I trained myself to give myself permission that it's okay that I'm feeling this way and it's okay that this is happening. But you know what? We only got a few hours left to today. Why don't we just wait until we get home? And then I would give myself permission to have this panic attack. And I would, as soon as my foot hit the threshold of my house,
Yeah.
and I shut the door and locked it behind me, I hit the floor.
So what you were doing, Adele, was giving yourself hypnotic commands, telling your brain, now is not a good time to have a breakdown. Now is not a good time to lose it at work in front of others. Maybe go into a fetal position and cry uncontrollably. So that's a very good technique to tell yourself. As think about it like this, listeners. It's like there's different levels of yourself. There is a higher self that regulates, call it your unconscious mind, call it your spiritual connection, whatever you want to call it. There is another consciousness other than the pain and other than your ordinary reality that you live in, that is in charge, that is resilient and cannot be harmed. That part of yourself, your inner spirit, you can have it talk to your body and say, you will have full permission to release this at the appropriate time. And again, tell yourself, like in your case, Adele, as soon as you hit the door of your home where you were safe, the body was free to release. The body was free. It had full permission, and you could be very intentional in carrying out the promise that you made to your body. Learn to be your body's best friend because you got to take care of it. No one in life will ever take better care of you than you. Learn to be your caregiver, okay?
Yeah. So my home was always my safe space.
Yeah.
And it's interesting because it's still that way today. I was just in a situation recently where some friends and I had an upsetting situation, and my friends commented that, and it commented that I was a bit more stoic than they were. And it reminded me that coping mechanism is still here today. And it allows me to be present in a way where I can be present in multiple moments. I'm present in the moment, and then when I get home, I can tend to me.
Yes, exactly. That's what I'm talking about, is shifting in and out of different personas, different spaces. There's research that's been done about how the brain has multiple processing centers, and we utilize different parts of the brain to process different emotions and different experiences. And so what you've learned to do, Adele, is to navigate those multiple intelligences of the brain, again, to regulate and to govern your emotions. So making that connection between mind and body.
Well, and I think it's very important that, yes, to make that connection with your mind and with your body. And then over time, you will start to see that as you're out processing, I still use this word to this day, as you're out processing it, I had, and for lack of a better way, I call them benders. I had PTSD benders sometimes that would last 2 to 3 days, and I would come out of them 2 to 3 days later, and I would feel like I released so much and I would feel so much better, only to have another one show up the following week.
Yeah.
But each time they would show up, the duration was shorter. The intensity was a little bit less. And so I think it takes the therapy, which what therapy is going to do is teach you how to be self-aware.
Yes.
The self-awareness is the key to all of it. Now, again, neither one Victor nor I are saying that we can, through these suggestions that your PTSD is completely, curable, but you have to do it with help. And so
Yes.
today, 30 years later, and I know when things are not right, if something's triggering for me, which doesn't happen very often, but still does, I know how to navigate that today. And I know how to talk to myself to give myself 5 minutes. I'll excuse myself and go to the bathroom or something and just go sit down and give myself 5 minutes to breathe and collect myself and go, you can deal with this when you get home. And then I go back and I go back to where I was. And by nowadays, it doesn't happen. Like I don't really have those long cries, and I don't really have, it's been a long time since I've really had a severe panic attack. But I think the most important thing is, like with any therapy, the basis and basics of therapy is to deal with what's bothering you. So that's no different with this. The difference is that it's a bigger, it's complicated, and it can be very complex because of how PTSD can show, which it shows up different for everyone. And, and let's not go without mentioning that there's medical management in many different ways. There's therapy. There's also, medical therapy where you can take certain medications to help you navigate your days if it's too hard, or certain medicines to help you if it is crippling, But the most important part is, while you're taking the medication, is that you get the help. And then, of course, there's other modalities like the ones that you're certified in.
Yes. So there's all kinds of short interventions that you can learn to do on yourself, such as emotional freedom techniques. I'm actually certified in EMT. EMT listeners had to start with a psychologist that he called it by a different name, and it was the creator of EMT that studied under Callahan was the name. Dr. Callahan developed a tapping technique to where, how you have acupuncture points in the body?
Yeah.
Well, it turns out that if you tap, for example, right here in your prefrontal cortex, if you tap on there, if you're having a panic attack, if you just tap on there, and there's all kinds of resources now on YouTube. I'm going to put links in the show notes that you can look at. If you tap while saying a almost like a mantra, there's all kinds of things you can say. Even though I'm feeling anxious, I accept myself fully and completely. What you're doing is you're combining different parts of the brain. You're using different parts of the brain because, one, the tapping is automatically triggering a certain part of the brain. And what it's doing is getting you to focus on the tapping as opposed to being flooded with the emotion, okay? And the good part about this is that you're not repressing. You're going with the flow. You're releasing with the flow, but you're doing it in a more controlled method. Does that make sense? You're listening to Courageous Healing Podcast. We'll be right back.
Looking for the perfect soundtrack to bring your project to life? Meet Roy D. Haston, an experienced composer who creates captivating music for films, commercials, and live events. From emotional scores to upbeat, energetic tracks, Roy's compositions add depth and emotion to every story. His unique soundscapes elevate your project and leave a lasting impression. Visit roydhaston.com and discover how Roy's music can transform your next project into something unforgettable. And thank you, Roy, for your original music for our Courageous Healing podcast.
we now return you to the Courageous Healing Podcast. Instead of it just breaking the dam and everything gushing, you're doing it by opening the spigot and slowly releasing it. So it's called Emotional Freedom Techniques, EMT. I'm going to put some links in the show notes that you can look at. I'm also certified in brain spotting, which is the new generation of EMDR. EMDR stands for eye movement desensitization technique. And brain spotting is the next generation of that. Again, that was also developed by psychologists. I got certified years ago, and I've used it extensively. And of course, I'm a certified clinical hypnotist and also certified in neuro-linguistic programming, which is a combination of different modalities, different disciplines combined all into one. And so there's a lot of things and there's a lot of resources that you can do, listeners, to where you don't have to suffer alone. You don't have to go at it alone. You can learn to be your best advocate. And of course, by all means, seek professional help. Shelters have highly trained specialists, psychotherapists and social workers that are trained in a lot of these modalities to do rapid interventions with you if you are in a crisis. There's clinics everywhere that will take you if you don't have insurance. If you have limited income, they will do a sliding scale, and most of the time it's free therapy that you can get. So there's no reason for you to suffer. That's the message that we want to make clear to you.
No, absolutely. There is no reason for you to suffer. And, we want you to find your absolute way to heal. The way that I healed and the way that others heal is all different. So while I'm telling you that I sat on my floor for 3 days and cried and went through and had a severe panic attack, that may not be the best avenue for you. That may be something that you need a greater intervention in. However, because my therapist really sat down and explained to me what PTSD was, I took it to heart. So there's ways that there's a multitude of ways. You just have to find what works for you. And you have to find it within you to go into this with a positive mind frame. You have to go into it where you're going to believe that you're going to find the help that you need. Because sometimes if you're going into this and you're like, this isn't going to help before it even starts, then you're not going to be unsuccessful.
Yeah, I want to talk about it though, because that's a topic that's near and dear to my heart. Expectation. If you have faith, it is your faith that is going to be activating the process for healing. Okay, I'm going to say it again. It is your faith. No one has special powers, but when you open yourself up to receive counseling, to receive expert advice, to receive interventions, it is your faith that is actually making it work. Because I have had numerous cases that I did the exact same technique, the exact same intervention, but because the person had a closed mindset, nothing ever happened, okay? Right. Whereas with someone that came with an open mind, that they were sick and tired of being sick and tired, they were ready to do whatever it took, then those were the people that got the full benefit. And of course, you put yourself out for these kinds of people because you see that they really appreciate and they value your time and the effort that you put into working with them. One of my instructors was a world-famous psychologist, Dr. Jeffrey Zeig. He said that his master teacher told him that his criteria, and he studied at his feet, so he was there right along to witness it. One of Dr. Milton Erickson's criteria is you have to do things exactly as I tell you, because if you don't, I will have to refer you out. I will have to discharge you and refer you out. The reason that Dr. Erickson was like that, again, he had seen so many different cases that if people didn't follow the instructions that he gave them, that was a sign that they were not open. Let me give you a specific example of what I'm talking about, listeners and Adele. You've been out to Arizona, yes?
Yep.
You ever heard of Squawk Peak?
I don't think so.
Well, supposedly it's a peak in near Phoenix, Arizona, and one of the instructions that he gave one patient, Erickson did, is to go to the top and then come back and report to him what it was like. Now, when the patient came back and reported the experience of going up to Squawk Peak, and it was all negative. Okay, it was all negative. It was dusty. I was afraid of getting bitten by a rattlesnake. It was hot. It was there was a lot of dust in the air, pollution, that kind of mentality. Dr. Erickson knew that that person was going to be very difficult to work with because, again, they filtered everything through a lens of this is awful. It's like, and again, you can just imagine the criticism. I don't know what this has to do with therapy. Whereas if he had a patient that came back and said, "Oh, it was a wonderful experience," the unique foliage, the lizards, the hogs flying above, the crisp air. Again, it was through the lens that they were experiencing the experience and following Dr. Erickson's instructions. And another, again, he was a legend. He is studied at length in all fields of communication. Another experience that comes to mind that Dr. Jeffrey Zach told us in class is he had a patient that came in with OCD, obsessive compulsive disorder. And so he told the lady, "Are you willing to do exactly as I tell you?" And she said, "Yes, of course. I'll do everything that you tell me, Dr. Erickson." So he gave her the instructions that she had to. She was a clean fanatic, so she had to go home and only spot clean a corner of a particular room. Nothing else. Okay, nothing else. She had to obsessively clean just the corner. And of course, what he was doing was he was breaking the pattern. He was behaviorally inducing change through giving all kinds of exercises to the patient. He was very dynamic and a genius at doing very dynamic interventions with patients. And of course, that was the genius of Dr. Erickson. And I studied at the feet of his pupil, Dr. Jeffrey Zeig. So again, I take the very same philosophy towards change in therapy is you've got to have an open mind. If you don't, there is no one that can help you. Maybe you're not ready. Maybe something else has to happen before you can get to that point. So it's better if you go at it with an open mind and just see what happens.
Yeah. I mean, and that's the hard part is going in without being pessimistic.
Yeah.
And now when you go to see a therapist, please know that you're auditioning your therapist for the first time.
They are a service provider, just like a mechanic, anybody else. Most therapists will do a free consultation for you to interview them. Think about doing an interview to hire that particular therapist. And even if they don't pay the full price of whatever it is that they're charging for you to interview the therapist, and we could even go into a future episode of how to properly interview a therapist to see if you're a good fit. Yeah. Because everyone has a different philosophy to therapy, and you got to find one that matches your philosophy, your style, your personality, so that it can be easier for you.
Yes, and that's exactly what happened with me. Is that I was fortunate enough to have a therapist who I bonded with very quickly and was able to have conversations. Because here's the thing: with your therapist, you have to be vulnerable. You have to be open. You have to say, oops, I got the hiccups. You have to say everything. You can't go into therapy and not talk.
Yes.
You have to go to therapy and you have to. So if you're not comfortable being vulnerable in front of that person, that's not your therapist.
Let me address another very important and salient point here. That is that if you were with an abuser that constantly gave you threats, what they did is they put locks into your throat so you wouldn't speak, and in your mind by saying something like, if you ever talk about this to anyone, I'm going to kill you, I'm going to kill your family, I'm going to kill your dog. That's the kind of threats that I'm talking about. And so what they did, imagine having locks on your throat to where you can't speak. And a skilled therapist can distinguish that, and you need to be aware that you may have some hypnotic programmed beliefs that you can never talk about your experience. And so you must overcome that for you to be totally transparent and honest with your therapist to answer any and all questions that they ask of you. I once had a physician, Adele, that came to me and he said, I know I got to be open with you and tell you everything because that's what I expect of patients. When they come to me and I ask them questions, I said, that's right. There's two people you've got to be totally honest with. That's a personal trainer to tell them how much you can lift because you don't want to hurt yourself, and a therapist or a physician.
Yes. It's important. I mean, and I think that's one of the things. Make note, Victor, we'll definitely have to sit down and have a conversation, and talk about, how to, questions that you can ask to interview your therapist or in going about finding your therapist. Because nowadays, the great news is you have telehealth.
Yes.
So
and if you don't like your therapist, you can switch it and nothing happens, okay?
The other thing too with telehealth, and that's something I haven't really researched a lot of, but we'll have to do some research before we come back because there are online therapy websites where you can go and it's not very expensive.
No, I've referred different clients in areas that they could go either in person or they could do telehealth through phone or through Zoom to get professional help. And again, these platforms, they do a very good job of matching a therapist that for what you're looking for, the skill set that you're looking for, and the experience that you're looking for. For example, if you're looking for a Christian therapist that is going to be sensitive to your faith and your beliefs around religion, they can match you up with a Christian therapist.
Yeah.
Or someone that is a certain age to have lots of experience, or that has worked exclusively with certain nuanced segments of psychotherapeutic interventions.
Yeah, it's important, and again, there's multiple modalities of therapy, of different types of therapy. We're not even scratching the surface.
No.
On what can be done for mental health and PTSD, and especially when you're experiencing trauma in general.
Yes.
Trauma like this, we're not even scratching the surface as to what types of therapy you can actually get. So one of the other places is to obviously start with when you talk to a therapist is also, talk to your physician. After I had been finished with my therapist for about 10, 15 years, I started having some situations that were very upsetting to me and that were very triggering. And it just so happened to be that my gynecologist was the one who gave me some referrals to a handful of therapists. And while the list that she gave me, those people weren't available when I was available, one of them was able to give me a referral to someone who was. And it was great. And that was, for me, the first time I actually even worked with a male therapist. And it was really, it was a different experience, but I liked it. And it worked out very well for me. And so I saw him off and on for about a year. And, it was really helpful. So I'm an advocate of like therapy and continuing therapy and finding help when you need it. But as Victor and the things that he's certified in, for someone like myself at the stage that I am, I can go to someone like him and he can help me if I need help.
Yes.
So there's various stages of help, and there's various stages of the type of help, and there's various stages as to where you are. So really it's about talking to a doctor, whether it's your physician or your gynecologist or someone who just can say, hey, look, why don't you try this type of therapy? Or you go to find a therapist, or even more important, you find a psychiatrist, because a psychiatrist will be able to prescribe you medication. And not only will they be able to prescribe you medication, but they will also be able to prescribe different things, different types of treatments that therapists cannot do as well.
That's correct. I had a call from a client, longtime client, that his wife wants to seek local professional help. And he wanted to know, what is the difference between going to a psychiatrist and a psychotherapist? And I explained to him that given the history that I know about his wife, the first step to start with is go to a psychotherapist, get a referral for a psychiatrist, because she needs to be under some kind of mood stabilizer so that she can function a little bit better than what she's going through. And so that's the big distinction, is that generally psychiatrists mostly prescribe and regulate medications that deal with controlling your mind and your emotions. And a psychotherapist, and some offices, they have both a psychotherapist and a psychiatrist under the same office working together in tandem so that you're getting the best of both worlds.
Mm-hmm. Exactly. I think it's important. I think it's important to know that, if you don't know where to start, just start with your physician.
Yeah, absolutely.
Start with your physician, or, like urgent care, emergency room.
Yes.
Or if you don't have insurance, like I said, there's multitude of ways that you can find. And it's an unfortunate thing, because we know we can't talk about mental health, and we can't talk about how people, how important it is without the limitations of mental health available to all of us.
Exactly.
So, but I want you to know that if you try hard enough, you're going to find the right help that you need. And it's just might take a little while.
And you shall find. Okay.
Yeah.
Another caveat that I want to tell listeners is, if you start with a bad psychotherapist, don't give up. Okay.
Right.
Don't give up on therapy, because there are some psychotherapists out there that you're not going to click with. They may say the wrong thing. They're just as human like you, and maybe they're having a bad day and they're not very, very empathetic to what you're going through. But never give up on you being an advocate for yourself.
Yeah. Yes. I mean, like I said, keep trying until you find one you like.
There you go. Is that enough show, Adele?
I think it's enough show for today, Victor.
Well, we're going to have to leave it there. It's been a great conversation, and maybe the next conversation, we do drill down into more techniques that people can understand what happens in therapy. Maybe even bring a psychotherapist to interview them that works with domestic violence victims, and talk about their experience in working with victims. We're going to bring you the goodies, listeners, because we're very committed to helping you and heal courageously in your life journey. Yep. Any final words, Adele?
No, just live your best life.
There you go. Until next time, friends, go out and have a great week.